Hello and welcome. I'm your host, Ramesh Kumar. This program is brought to you by the Healthcare Administrators Association, HCAA. For over 40 years, HCAA has supported third-party administrators and the self-insured employer industry through educational opportunities from leading industry experts. For information on joining HCAA, please visit our website at hcaa.org. How has the stop-loss market changed its view on small group funding? And what's the secret to a long-term, sustainable self-funded plan? In this episode of Voices of Self-Funding, host Ramesh Kumar welcomes Jonathan Socko, President of East Coast Underwriters, LLC, a Managing General Underwriter, MGU, specializing in stop-loss insurance. Jonathan shares his perspective on stop-loss underwriting for small groups and unveils the blueprint for a remarkable success story, a 30-life employer group that has successfully self-funded for 10 years with their PMPM costs increasing only 10% over that decade. You get to learn from this case study. You'll also learn the crucial role of partner cohesion between the broker, TPA, and stop-loss carrier to manage claims proactively, and why data transparency and specific data flow are non-negotiable for effective claim prediction and management, and the essential mindset shift, a commitment to aggressively attacking costs that ensures a small group's self-funded plan remains successful and sustainable. Don't miss this conversation for an insider's view on stop-loss and the strategy that delivers long-term savings. Tune in now. Jonathan, I am super excited to have you on our podcast today, and thank you for doing this. You have a very illustrious career in self-funding space, and I would love to hear directly from you. Why should our listeners listen to you?
No, I appreciate it, Ramesh. First and foremost, thanks for having me. I was really excited to have the opportunity to speak with you and speak to your audience. Yeah, I've been in this industry really my entire post-collegiate career. I came out of college and I went to work for one of the largest third-party administrators in the country at the time. And it was almost like going to self-insurance grad school in a way, just learning the ropes. The first thing I ever did in this industry was pay a claim at a TPA. That was my first job. A couple promotions later, I decided to leave the TPA space and get into stop loss and reinsurance. And this is where I've been since late 2012. Really, all I've known most of my professional career is self-insurance and stop loss. It's certainly not what I went to school for. As I think you'll find with most people in this industry, I tend to not intend to get into this. But I love this industry. It's very near and dear to me. It's something I'm passionate about. It's kind of a hard industry to talk to your friends about around a dinner table somewhere sometimes, but I really love this industry and I'm passionate about it. So I think my professional background definitely lends itself to having hopefully some credibility with your audience.
If you were to pick over the last 16, 17 years, what are some of the big things that you've seen changing that are now driving some of the impact in terms of risk reduction or cost reduction, or maybe increases? Sure. Maybe just something to set the context for our listeners.
That's a great question. I came into the industry in 2009. So the TPA I went to work for basically right out of college. They hired me in June of 2009. And for those of you that have been around long enough and understanding where we were in the industry at that time, that's pre-Affordable Care Act. So I got in when things like lifetime maximums and annual limits were still in place on the plans that we were administering. And it was a different world, just things today that seem so out of place and crazy and unusual. Yeah, even in 2010, before the Affordable Care Act was passed, there were just things that you didn't really see. You didn't see $1 million claims. You didn't see $2 million claims. Mm-hmm. Occasionally, would a stop-loss carrier back then have seen a $1 million claim? Sure, but it was the odd of the odd. It was the outlier of the outlier. You never saw these things. And quickly after the Affordable Care Act was passed, I'll never forget this. It was as if overnight, all of the SPDs that we would begin implementing from that point forward had all of the provisions in them that made these plans ACA compliant. Early on, you had plans that held on to grandfather status and things like that, but it was like an overnight change. At least that's how I can recall it. When I moved into stop loss specifically in 2012, We had already entered the world of there were no annual maximums. There were no lifetime maximums. So you had unlimited risk. And in those days, it was still a bit in its infancy. The industry was certainly far different then than it is now. It was still very unusual to have a claim that would be well into the $800,000-$900,000 range, much less $1 million. And as time's gone on, of course, that's become more and more commonplace to the point now, whether you're an MGU or you're a captive manager, even if you're a direct writing stop loss carrier, everybody sees them now. That's definitely the biggest change, is just how big the claims have gotten in 10, 15 years.
So then how are you seeing smaller employers, 15 to 50 employee life employers, how are they accessing self-funding despite this claim shooting up to $1 million? What are some of the things that guys are doing?
It's very difficult for small employers to have sustainable self-funded health plans. There's really two routes that these plans can go, like two major routes, right? You've got the carrier model, level funded products, so Cigna, Aetna, et cetera. State Blue Cross plans oftentimes offer them too, these bundled level funded solutions, or you have unbundled self-funded solutions administered by a TPA. So whether or not we're talking about captives or unbundled level funding, I'm lumping that all into the same group because it's really the BUCA level funded plans or the unbundled TPA administered small group self-funded plans. Those are really the big distinction. And I think groups in a short term, sometimes they may be able to yield what they would call savings on a BUCA plan that's level funded. I do think that those tend to be somewhat artificial in nature, because if you find a BUCA that is really going after the small group level funded space, first of all, often that's somewhat publicized. I mean, if you dig deep enough online and reading business insurance articles and things like that, somebody's publicized, oh, we love the level funded industry. We're trying to increase our market share. And that is kind of code for, hey, under the right circumstances, we're going to buy business. So what those employers view maybe as, I'm just going to use air quotes, savings, I think tend to be very short-term in nature and also short-sighted, by the way. If they're saving 20% the first year, okay, maybe you're buying yourself 2 years. Because if they save you 20% year one and they hit you with a 25% increase the next year, okay, over 2 years, you're not doing too bad. It's just when that compounds year over year over year that the plan sponsor and the broker realize that something's actually wrong. I think it's going to be no secret to much of your audience, but those plans don't have any amount of transparency beyond just a monthly report, a snapshot. You can't really dig into the data. On the other hand, the unbundled route, you're using a TPA to administer your claims, and maybe you're a 30 life group. First of all, it's hard to find TPAs that are willing to administer a 30 or 40 life group. I think from their perspective, they would tell you that it's hard to generate good revenue off of small groups, which is true. But in order to do it, first of all, you have to have disciplines across every spectrum that's touching that case. Stop loss, carrier, MGU, captive manager. You have to be disciplined in your first year underwriting. The last thing you want to do is underprice that business to the point that next year, we just talked about a 25% increase on a BUCA plan. What if it's a 50% increase because you significantly undershot your attachment point? You're doing a discredit to everybody. The broker has to really understand the most up-to-date cost containment, risk management principles and self-insurance, because the bottom line, at least from what I've seen in my career, is a 35 life group is not going to be sustainable unless they either just get extremely lucky, which we're not just in the luck business, or they have a very well set up and managed self-insured plan, top to bottom. The TPA has to be in line with stop loss, has to be in line with the pharmacy controls and all the other cost containment solutions that they're throwing at this group. That's really the only way it can work.
So what does that look like? You kind of said 35 employee life group. In order for this to be sustainable and for the TPA to make money on the administration as well, it's got to be well stacked up with all the things. What does a good plan look like in your experience?
Yeah, it almost feels like it has to be a perfect storm too. The other thing I'll say to sort of your first question is the pricing might just not work out. And that's the thing, is a group might be head over heels with the idea of self-insurance, but if their fully insured plan has a really low per employee per year cost, the only way you can make the financing line up is by being undisciplined in your underwriting. So let's just presume that you have that sort of that Goldilocks zone where the employer's per employee per year fully insured cost is really high.
What does that number look like? where this is?
You'll get varying opinions on that. I think the number has definitely gone up a little bit. I would say anything less than probably 10 to 11,000 PEPY makes it really, really difficult to self-insure. And again, that's not a perfect number. Does that mean that an MGU or a captive manager or us, frankly, have never written a piece of business that has less than that number? For sure, but that could mean a variety of things. It could mean the reference-based pricing, and that's a game changer in terms of that affects your projected maximum cost. And speaking of reference-based pricing, I think that's your safest bet as a small group. And again, realizing that's not for everybody, right? I'm not going to sit here and tell you every single employer in the country should consider RBP. I love RBP. I wish, from a risk perspective and selfishly, I wish every group could do it, but it's just not the reality of the marketplace. I think that's the safest bet. If you're 35 lives and you've just had it and you're paying $17,000 PEPY and you can't take the increases anymore, RBP all day. It's a smaller group. In theory, you're going to be able to ride the wave of any noise that could pop up a little bit easier than a group of 500. You get this huge HR department in those situations that make it really complicated. I think on a smaller group, first of all, the executives with the plan sponsor are going to be a lot closer to even like the hourly workers. Can they get everybody to really buy in and row in the same direction and understand how RBP is going to significantly change their annual cost and their contributions? Absolutely. That's probably the easiest thing you could throw in there. But again, it takes the right employer. I think that overnight would solve that 35, 40 life employers' problems. But again, it's a really hard concept to buy into. So short of that, I think you need to have a few things. You certainly need to have a TPA that's not going to auto-adjudicate claims. You probably want to consider a PPO network that's a non-BUCA, frankly, just so that you might be able to get a chance at a second look at even in-network claims. The tricky thing with BUCA networks is, their average discounts might look on paper to be better than regional networks, but you're also beholden to the network. You can't decide that you want to audit a Cigna claim and send it out for secondary review. If you're doing that and you're the stop loss carrier, you're violating the group's contract with the network, and you do not want to put them in that position. So having a non-BUCA, maybe a regional network that does give you some flexibility on something that looks a little weird, maybe you send it out for secondary review, is very helpful. It also allows you to have tighter controls around case management, utilization review, and the pre-cert process. So all of those things are very important. And then the big one we haven't even talked about yet is pharmacy. You have to have the highest quality PBM, and you may want to consider having a secondary repricing methodology for specialty drugs. I'm going to leave that somewhat broad because there are so many great companies out there that are able to help plan sponsors access specialty drugs at a significant discount from what the PBM might be able to do. Some PBMs have these programs internalized, so sometimes you do need a secondary kind of piggyback onto what the PBM is able to do. Sometimes you don't. But those are really the big pieces of the puzzle. If you can get away from the BUCA network and you've got the ability to manage steerage of care on the front end through the UR process and pre-cert process, that's humongous.
With that kind of in place, what kind of PPM cost do you end up seeing, or PEPY? Do you have a sense where things end up landing?
I think on a percentage basis, if the group comes in and they have their eyes wide open, I don't think it's outside their realm of possibility, because you have to account for things like leverage trend and groups over time increasing their spec deductibles. I'll give you an example. We've had it's about a roughly a 30 life employer group. We've had for 10 years. We just renewed it. So for 1/1/26, this is going to be the 10th year we've had the account. We wrote it for the first year, 1/1 of 2016, which is crazy. I don't know how often anybody holds on to groups that long anymore. But if you just look at the group's PPM, their costs since they've been with us have only increased on a PPM basis 10%. It's insane. That doesn't happen now. Granted, that group has increased. I think I saw earlier that they've increased their spec deductible in that 10 years, $15,000. So the spec deductible as of 1/1/26 is going to be $15,000 higher than it was in 2016. That's a big change for a small group, but they've done a good job on the concept of leverage trend, meaning they can have to account for the fact that a stop loss claim next year is going to cost more than it did today in its simplest terms. But they've been sustainable. They have a lot of these components in place that we just talked about. And is there a little luck involved there? Yeah, sure. But they've done a tremendous job because, again, the broker is aligned with the TPA, is aligned with the reinsurer, stop loss carrier, which is us. And it's been really easy to get through that every year, even though it's 30 employees. Those are the groups that when we write them, you're going in with your best foot forward, of course. We have very disciplined underwriting, disciplined medical review team. So you're not walking yourself into anything, but it doesn't take much bad luck for a 30 life group to go sideways and the group to get cold feet and get skittish and hit the ejector seat for fully insured.
So this is pretty good though. Over 10 years, this is like consistently you've done this. So it's more than luck over here. And,
I would say so. Believe it or not, our loss ratios on 25 to 50 life business, we'll just define that as small group. I know for a lot of people, sub 100 is considered small group. For some people, sub 500 is considered small group. But for us, for what we do at our MGU, in our captive management company, 25 to 50, that's what we consider, air quote, small. Our loss ratios on that business are like 15 to 20% better than our average, which, I mean, we have good historical loss ratios. So our small group loss ratios are better than our company average, which is phenomenal. A lot of that is because you've got to be very disciplined in your underwriting. You do have to be very careful, but it's because of our partners. It's because of our brokers and our TPA friends. Again, it's the cohesion and everybody being on the same page. And of course, you were in the risk business. There's a little bit of luck there. Most of those groups have a lot of the features we were just describing. I'm not going to sit here and tell you they're all reference-based pricing because they're not, but probably a third of them are. Probably a third of them.
Maybe as you started to talk about this renewal over 10 years consistently, what kind of things have you done with them? So you put specialty drug program, I presume, and you've got that network outside the BUCA. It's a reference-based price. Have you done all of those things with them?
With this group specifically, they've been on a PPO plan for the whole 10 years. They have not done RBP. They have a good consultant. They have a good advisor. They have a good TPA. They look at the claims. If something pops up, they could jump into action. Is there a way we can maybe steer this member to a facility that has a better outcome for knee replacements or whatever it may be? They're routinely sending us everything that we, in a perfect world, would want every TPA to send us on a monthly basis. Just for your audience's understanding, we want to see from our TPAs, and this is on a monthly basis, it's not just enough to get the 50% report. That's the bare minimum what a TPA should be sending the carrier, MGU, whoever is on the reinsurance is a 50% report. We want to see 50%. We want to see pre-cert reports. We want to see case management notes. And we want to see trigger notifications. If we're getting those, and by the way, if the broker is looking at all this stuff too, everybody's on the same page. You may be able to get out ahead of a specialty drug a little earlier. Is there some sort of a couponing program or patient assistance program that's available for this drug? If these things are happening quickly or routinely, you can get out ahead of claims.
So if having all of those data points as well, triggers and things like that. And what the cadence you're saying is monthly, or would it be better to have it as soon as it happens?
As they occur. It's hard, right? Most TPAs have a lot of staff wearing a lot of different hats. I think it's hard for TPAs to do that consistently and routinely as those things come up. So I would say, if they're able to do that consistently on a monthly basis, everybody wins.
And then what would you do with that once you do have that trigger diagnosis and other kind of data as well? What do you then try to do? Do you work with the TPA? Do you try to bring in the case management?
Could be all the above, depending on the complexity of it. Maybe you're looping in the broker too. Do we have reason to believe that the PPO network's contract is for some reason going to be inadequate with what we're anticipating? Is that something we can maybe consider getting out ahead of? But again, it takes the cohesion because you want to be careful. You don't really want to leave the broker in the dark in those potentially complex situations because they need to be able to potentially speak with the plan sponsor in advance if it's going to be something overtly complicated. Are we trying to redirect and steer care? Those can be tricky situations. I think it takes the cohesion of all those parties for those things to work out well. But it could be any number of things. It could be redirecting or steering, or maybe you're even consider deploying a vendor solution or a cost containment initiative in the middle of the plan year that doesn't exist today. But again, for a group of 30 employees to be sustainable, that broker's never getting fired, right? If they're doing all these things, and again, in my example, if this group has seen a 10%, a bit of that is curved for things like spec deductible increases over 10 years, but that broker's never getting fired. What could another broker possibly bring to that plan sponsor that is going to wow them? If the broker can be involved, almost as involved as the TPA and the stop loss carrier in those situations, and they want to be involved, you got yourself an all-star team.
Let's hear from the sponsor and take a quick break. You've been listening to incredible insights on the future of self-funding. But for you, the growth-oriented executive at a third-party administrator, a critical question remains. How do you turn these industry insights into market differentiation and real profitable growth? In a crowded market, winning new business against the big VUCA carriers is tough. You're constantly struggling with low member engagement and an overwhelming volume of tactical support calls. Zaki Point Health is your digital co-pilot for care navigation and growth. We provide a multi-touch mobile member experience that drives 3 times higher engagement rates and cuts your administrative burden. But we know you need more. That's why we built the Zara AI suite to tackle your largest service challenge: routine provider and member inquiries. Using our voice, our portals, and AI bot technology, the Zara AI suite cuts your provider call volume for routine benefits eligibility calls by up to 50%. This is a massive leap in efficiency and cost savings that directly impacts your bottom line. And the beauty of our platform is that it is integrated with your claims system to drive data-driven direction for members, providers, customer support reps, and employers. No more silos and questions about the integrity of your data. TPAs partnering with Zaki Point Health are experiencing over 20% year-over-year growth. We equip you with the differentiated tools to win new business, satisfy employers with clear ROI, and scale your operations. Stop struggling. Start competing and winning. Visit ZakiPointHealth.com today and request a demo to dominate the middle market. Let's get back into the show.
What are some of the mindset challenges that you often come across, whether that's within the broker or the employer plan sponsor themselves of this 30 employee life groups?
Yeah. Oh, great question. So I mentioned earlier on about how TPAs find it difficult to have a reasonable ROI on small group. That's not just with the TPA, that's across the spectrum. If you're a brokerage agency, how much resources can you devote to managing every 25 to 50 life group that way? Well, a lot of big agencies, they have separate teams that handle big group, separate teams that handle small group. And out of the agencies that we've talked to, the ones that have these dedicated small group teams, like 95% of that business is VUCA. Maybe it's level funded or it's fully insured. They're just drifting. It's hard to have enough hands on deck to manage, because it does take a lot of expertise and an advisor that frankly isn't scared of the conversations with the group. And because it can be uncomfortable, because if you don't know that group really, really well, if you're not engaged with the CFO, and if the advisor and the CFO aren't on the same page, how the heck is the HR department going to be on the same page? And if somebody is contacted by somebody that's helping administer the plan to assist them in these challenging situations, they've just got a tough diagnosis and they're talking to their physician and they're having to go through this pre-cert process and everything else. So that's where it gets really hard, is the individuals that have to touch the group have to be so well versed in how the plan needs to operate and behave for all of these core functions to work in unison. That's the real challenge. Is the TPA, a lot of the TPAs that are willing to administer small group, they can do this in their sleep, but where you run into the challenge is if the advisor and the broker consultant aren't versed on how to do all these things properly, and furthermore, aren't willing to spend almost every day helping the group. That's where it gets really tricky too. And again, I don't want to slam any advisors that would just throw up their hands and say, pray for a 40 life group. It's just not worth it. For how their agency and their book of business behaves, that may be correct. And I am definitely sympathetic to that. But again, it's hard to turn a return on small group. I mean, even as a stop loss carrier, like this 10-year group, it's crazy that it's been insanely profitable for 10 years straight. It takes all the right pieces to be in place.
Yeah. So it sounds like working with the right partners for different pieces of this is a kind of winning formula here.
Yeah, and it's very circumstantial too. This is the most circumstantial situation. One of the most circumstantial situations I can think of is a 10-year, 30-life group that we've had since 2016. It's just, those are very rare situations. That's not the only one. We've got many a group very similar, but what all those groups have in common is the plan sponsor is on the exact same page with the broker, and it doesn't take much for the TPA, the PBM, and stop loss carrier to be in unison behind them. It's really first and foremost is the plan sponsor and the broker have to be on the same page and understanding philosophically what are we going to do to attack costs and really just be aggressive.
And so having that clear plan, alignment, having the right partners, as you described, and then ecosystem of partners for different pieces. So let's say all of that is now in place, renewal has happened. What are some of the things that you see, if you can walk us through what's a 60-day, 90-day, 120-day renewal plan?
No, great questions. Renewal on small group, in theory, is aspects of it are very easy. Aspects of it can be very difficult. It just kind of depends. Now, from reviewing the actual data, it's easy. Like ECU's nurse team, they love when a 30-life group renewal comes up. That case is probably going to take them an hour and a half to run through everything. And we look at everything at renewal. We look at all the reports I just mentioned, 50% pre-cert, funded reports, the group's PBM report. We're looking at all of these things on renewal. So our nurses love these small groups because, hey, this is going to take an hour of my day, and I can move on to the next thing. So the nurse review part that's where it can be tough is, maybe you have a 30-life group and you find somebody with multiple myeloma. It's a brand new diagnosis. That's a tough conversation. That's very, very difficult. You have to be very much outside the box thinking to manage that type of risk with a small group. Otherwise, again, most groups have a difficult choice to make. Do they hit the ejector button, go back to fully insured? Do they do ICRA? What are you going to do when you're staring down the barrel of a $500,000 risk? And it's not an opinion, by the way. It's somebody newly diagnosed with multiple myeloma. Those are very tricky situations. As far as the timeline, we typically get most renewal data requests in anywhere from 150 to 120 days out. So we're starting to assess groups' renewal pricing as far out as 150 days. Small group, frankly, there could be so much volatility in the month-to-month change that if you issue an initial renewal at 150 and we're issuing firm and final once the 90-day data comes out, the volatility is coming oftentimes in the aggregate attachment point, right? So groups running well, 150 days out, they're running at 55% of their max. Say this group's running great, no problem. You go to firm 90 days out, and they've had a really awful couple of months, and now they're running at 90% on their attachment point year to date. Much different story. Maybe the initial pass on the group was indicating a very nominal increase on their attachment point, and now you're illustrating that it needs to go up by 18, 20% because they're running a little hot. Those are very, very difficult. But again, claims are claims, and the data is the data. And that's where it gets tricky. Nobody likes surprises, but a couple things. Again, with small group, inherently you could have more volatility on your monthly attachment point just by design. Some of that's unpredictable. Could just turn out to be bad luck in that way. But the medical review piece can be really challenging. And that does happen, by the way. Maybe you do your initial medical review with 150-day data, 120-day data, and everything's fine. And I don't know, maybe they wait. Maybe things just take a little longer. So maybe in that situation, that's when your multiple myeloma pops up and the group hadn't locked in, and now you have a brand new diagnosis that wasn't there just 2 months earlier. Again, tough situations. And they do happen. They happen every day in this industry. It's tough. But yeah, for us, I think it's fairly standard. We're usually trying to push our smaller groups to lock in around 90 days. I think it's becoming a little less common across the industry to be able to get small group lock in 120, God forbid, 150 days. The loss ratio is going up really across the board. I think it's gotten more challenging to find people that are willing to lock in further out than 90.
Well, this is really helpful playbook for people to think about. Any kind of last thoughts as the smaller groups, as they're thinking about these renewals, as they're thinking about costs and wanting to leverage self-funding, anything that we may not have covered?
No, I think if you're already self-insured and you're a smaller group or you're a broker representing smaller groups, again, I would think about don't wait until close to renewal time to peak under. the hood and see what's going on with your claims. For these small self-insured employers, again, in a TPA setting to be sustainable, you have to look at this stuff every month. You almost have to look at it more than that, to be honest with you. But to make it sustainable for the group sizes that we're kind of talking about today, and again, I'm just sort of using 25 to 50 or 20 to 50 or 20 to 75, but whatever you want to determine to be small, I think you really have to look at the group's data on a consistent basis. Can you get lucky? Sure. But I think that's the way it has to work. And if you're an advisor and you're thinking about how am I going to help small groups make the transition to self-funding, again, I think that's sort of the core competency, right? It's looking at everything on a consistent basis. I think if you help manage the claims as they're ongoing and not waiting until the renewal for the surprise, you're definitely better off.
That sounds great. So how can our listeners get in touch with you?
You can reach out to me on LinkedIn, or if you want to shoot me an email, I can be reached jsocko@ecumgu.com. I like getting emails from people, and other than that, LinkedIn's a pretty easy way to find me. So I love hearing from new folks, so I'll hopefully hear from some of your audience sometime soon.
Yeah, maybe on a golf course, maybe on a ski slope.
Yeah, maybe on the slopes, maybe on the golf course. You never know. I spend a lot of my days at the hockey rink these days. I've got a daughter that plays a lot of ice hockey, so
oh, wow, nice.
maybe the hockey rink somewhere too. I don't know.
Nice. Well, this has been great, Jonathan. Thank you so much for taking the time to share what you're seeing for these small groups and where some of the opportunities are. And thank you for these.
Yeah, been a pleasure, Ramesh. Thank you so much.
Please join us again for another podcast in the series brought to you by HCAA's Voices of Self-Funding. Please like and share so we can build a community of like-minded people, and tell us about topics that we bring to you next. Please watch your email for updates on upcoming guests. I'm your host, Ramesh Kumar.